So now let's shift gears just a little bit and let's go to another way that prioritization questions are formatted. This is another common method of prioritization question formatting where instead of choosing the client that is the highest priority, we are instead going to try to find the task that is highest priority. So this question says, the nurse has been made aware of the following client situations. Which of the following client needs should receive the highest priority? So which need or task is most important for us to do? Option 1, administer an antibiotic to a client with cellulitis that was due 1 hour ago. Option 2, assess the client who reports redness and pain at their appendectomy incision site. Option 3, assign assistive personnel to stay with a client who is reporting suicidal ideations with a plan. And option 4, provide discharge education to a frustrated client who's been requesting discharge paperwork for 2 hours. So I see you guys are already answering this question, and certainly I love your answer, but I think we can gain a lot more knowledge by looking at our wrong answers here for a second. So option 1, administering an antibiotic to a client with cellulitis that was due 1 hour ago. So that is a routine task, antibiotics. And certainly we want to administer medications in a very timely manner, but typically delaying an antibiotic for 1 hour is not going to create any type of life-threatening issue for our client, okay? So that, once again, routine, not going to create any type of life-threatening complication. Option 2, assess the client with redness and pain at their appendectomy incision site. So if you guys are caring for a client who has a surgical incision and now they're experiencing redness and pain, what do you guys think is happening? What are you anticipating? Now this can be potentially, depending on the level of pain and erythema, it could be a normal finding, just having some inflammation at the site from the surgical trauma, but what else might they be at risk for if they're having redness and pain at a surgical incision site? So we are concerned about infection, but right now it seems localized. And this is my second opportunity to give you guys a really good test-taking strategy. Don't read into items. Don't add information. I was a nursing student once, and I know that that's very tempting. So we can go down this little rabbit hole and say, oh, if they have infection, they might develop sepsis. That's a circulatory issue. Don't do it. Don't mess yourself up, okay? Right now, let's just take all the items for face value. Let's not add information. This is localized redness and pain, so it's not appearing to be any type of life-threatening emergency. And then option 3, which is you guys' favorite, and I totally agree, is assigning assistive personnel to stay with the client who's reporting suicidal ideations with the plan. Because anytime a client has suicidal ideations, we should of course be concerned. But it really increases the level of acuity when a client has a plan. Many times when they have a plan, they have thought this through, and there is a much higher likelihood that they will make an attempt on their life. So that is, as you guys have said, a huge safety issue, which is a very, very high priority. And then last option, provide discharge education to a frustrated client who has been requesting discharge paperwork for 2 hours. So that is a frustrated client. I would be frustrated too if I'd been waiting 2 hours. But once again, psychosocial needs aren't really typically going to pose any type of life-threatening emergency or kill us. So I love option 3 is the correct answer, and we got it right.